Hello everyone. Welcome to our conversations with public health leaders. I am Dr. Charity, founder of the Next 100 Initiative. Today we have Professor John Idoko. He's a professor of medicine, former Director General of Nigeria's National Agency for the Control of AIDS, NACA. Also a former chair of Nigeria's National Antiretroviral Committee. Welcome, Professor Idoko. We want to thank you most sincerely for making time to inspire the emerging generation of public health leaders across the continent. Welcome.
Thank you for having me.
Great. So let's get you started. Share with us, please, some of the role models or mentors early in your life and early in your public health career.
Thank you very much. I have to look back very long, But I think at the age of about 11, I thought that my future was going to be a doctor. And this was fueled by the local doctor who was like a champion. Everyone saw him as somebody who was like the small god that gives you life. So this image now sort of was growing in my mind and in my head. Even though in secondary school I did very well in the maths and engineering courses, and my advisors requested that I should rather do engineering instead of medicine. But I really wanted medicine. Not that I was doing very well in those courses too. So that's the first thing. And so I went on to read medicine. And after reading medicine, at a point when we came out, somewhere in the mid-70s, a lot of money flowing from private practice. And I had a lot of friends who wanted me to go become private practitioners with them. But I thought that I hadn't gotten enough knowledge and enough experience, and I wanted to specialize. And here again, I had some very good mentors, and I looked at myself. I had, across all the disciplines in medicine, I said, look, you've got to do infectious disease, and you've got to do immunology of infections. And I had two great role models. One of them is Professor Brian Greenwood, and then the other one is Dr. Whittle. They had the first real immunology lab in ABU in Zaria. With time, they moved it to the Gambia, the Medical Research Council. There, Whittle retired, but Brian Greenwood went on to become a professor of medicine at the University College London. So these were really my great mentors, and you won't believe it. From third year medical school, I was already working in the immunology lab. So that's how I built myself up, and I'm here now, but I've retired. It's important to mention that. Retired but not tired.
Retired but not tired. Great. These two really transformational mentors you had. So what do you consider, from your experience in the public health space, as attributes for effective leadership?
Well, I grew up in science. You learn along the way. The big thing about science, one big thing is science breeds research. And what do you do in research? You learn the truth. So research is all about truth. So the first thing is, you've got to be true to what you are doing. You've got to be true to yourself. I think this is a major attribute. And I think that Warren Buffett summarized it. He said, you need three things to be able to advance in life. It doesn't matter what you are. You need intellect, you need energy, and you need integrity. So you wrap all these things together, So for me, that is really key, So I need to be truthful to myself, to be truthful to what I want to do, and to be truthful to others. So when you put all these things together, I think that forms the basis of my, And some people will wrap it up and being biblical and say, love yourself and love others. And if you do all these things together and wrap it up like this, you don't have a problem at all. So for me, those are, big issues. And obviously, the issue about your self-esteem, life ambitions. There are critical things that, you have to have a vision for yourself and have a mission statement for that. And usually, if you're going to succeed in anything, you need what I tell people, the rule of 3 P's. You need a purpose, which is the vision. You need to persevere, to work hard, be accountable to yourself over that vision, and you need people. You've got to connect with people. Because as an island, you never achieve what you want. That's why you asked me about mentors. So this is, for me, those are the driving things. Yeah.
Well, I'm sure as you watch this and listen, you're probably taking your own key takeaways. For me, what jumped out, integrity, true to yourself. Prof has practically revised, what is authentic leadership. And just speaking on the last point you made about people, can you please share with us, your experiences contrasting the difference or, similarities between leading a team internally as compared, to leading people externally, managing key stakeholders externally?
Okay, let me talk about leading the people internally. There's a saying that people won't follow what the leader says until they believe in the leader. I think that's a key thing. And that's going to that truism to yourself. So, break it down, not do as I say and do as I do. Not do as I say, but, I'm doing it totally different. So I think leadership means you must be a role model for the people you are leading. I think that's a very key issue. So that, whatever you say in them, go back to that word integrity. They believe in you. You say, I'm going left, they know you are going left. They won't hear that we should go left, and then the leader is going right. So those are some of the big issues about, So that's one thing. The second thing is that if you want to lead a team, you must be a team player. So you are the boss, but look at every other person as your boss. And let me give an example of my own leadership. I was DG in NACA for like 7.5, almost 8 years. And I went down to everybody's office to sit with them. People just I was laughing. But I got a lot of friends. By the time you have friends with the lower people instead of the higher people, you really enjoy it. And I still relate some of them up to today. On my birthday, they will still call me and say, so, by the time you do that, and then that goes even to the work you do. Of course, you take responsibility. But if you want to really achieve, your results, you need to devolve powers. So you take power and you give power. So we put all these things together, So the least person may be as important to you, particularly when you are communicating. If you don't communicate with everybody in the place and then get a feedback, you have a problem. You will find out that, especially given our own scenario, a lot of the people who are close to you want to hear what you want to say. But if you have friends diverse within the organization, you'll be surprised. The lowest person will come and give you the greatest advice. So it's very important that, you communicate and you connect with both everybody in your organization. So I used to call it word round. So I go what we do in medicine, I'll come and sit with my secretary, he will tell me stories, I see somebody, maybe an assistant director, and I recognize another very important thing. There's a rule of 20-40-20. Everything you do, when you are dealing with teams, what do I mean by that? 20% of the people will be raising the organization up. 40%, you don't look. Then 20% will be pulling you down. But everybody is important. So when you have to be able to recognize this in the team, is this kind of person who pulled this place up? What can I challenge him with? Because everybody has his own skills. It's just like the body we have. Everybody, the body, the hand, the leg, everybody has skills. So you now look at the person. How can I use this person? And it's important to look at the 20%. There's very good people there, but they have different, the vision and mission statement is, and it's your job to communicate with them and change their psyche and their mindset. And you'll be surprised, because that happened to me. When I got into my office as DG, there were so many people who didn't like me because they were so attached to the person who left that they couldn't see me, and my style of leadership was different. So I had to now get them to be on my side, explain my vision and my mission, and that's how I won some of them back. Of course, I didn't win everybody back. So, but that 20%, you have to put an eye on them because they are the spoilers. But they can move from that there to the 40% who are just walk. And some people, you can't change them. They will do their work and go home. But if you challenge them, they're not going to do anything. So you look at, that 20% there. It's a fluid thing. And you say, look, how can I challenge these ones? These ones, how can I build them up so that they can move across, the spectrum? So that's very, very important. If you don't recognize that, then you're going to have problems. And then among the 20%, there are real people who will damage the organization. And you have to keep an eye on them. Just like as Mandela said, keep an eye on your enemy. Because if you don't keep an eye on your enemy, then you have a problem. So for me, those, and I think the other very important thing for internal is motivation. You must reward people. There has to be a reward system. And you make it very clear. And for me, it was easy because I came from an academic background. So I was very open to that. I said, look, if you do well, you'll be rewarded. And we had things that, not necessarily money, we take you to conferences, we give you that. So those type of things are extremely, extremely important. Working with the external is also a big issue because my own experience, every external person has his own agenda. So that's the first thing you have to recognize. But I was working for the government of Nigeria. So as far as I was concerned, the government of Nigeria agenda was on top of it. So if you don't recognize that, and I had a lot of issues with some of the development partners, and I can mention a few of them. For example, Nigeria was one of the first countries to start an antiretroviral treatment. People remember Obasanjo, because Obasanjo was so worried about people dying from HIV that he sent the minister to India and said, look, I need those drugs. So even before PEPFAR arrived here, we had started our program. Of course, when PEPFAR came, PEPFAR was big, it was huge. It ate all our patients up. We had 15,000 patients by the time PEPFAR came. But because there was more money and we could look after the patients a lot better, we now took over all the patients. So when I became DG, first of all, I was the chairman of the National Antiretroviral Therapy for a long time. And I actually grew up, like I told you, infectious disease, and then, of course, HIV. And I used to call myself treatment physician. So it was easy for me to understand, the dynamics of what was happening. And here we are. Everything was coming from the US, the government. So I said, no, we are losing our institutional memory. So I now challenged PEPFAR. And I said, look, we can't continue like that. We're not going to be here forever. One day you are going to leave. We need to go back and start learning our ropes. So you must cede some of the states to us. In fact, it is what has now become the Taraba and Abia. Because they said, okay, we'll give you 2. At first they refused. They even asked me, are you sure that you will give us this money? I said, why? It's not about money. It's about ensuring that we have some kind of institutional memory. We can build our own capacity so that when our government decides to put more money into it, we can. So, I just said this in 2 sentences, but it took me to Washington to meet the PEFA coordinator, and it took me to Geneva to meet both PEFA and UNH. But in the end, we won, and that's why we have government of Nigeria can boast today that they are treating like 50,000. It should be more than that now, but I think that's for another day. So those are the things. So you really have to, what is your agenda? And that agenda must sort of swallow every other person's agenda. And if you don't recognize that, you will have big issues. And then, of course, teamwork is very important. Teamwork, you've got to work with the team. And you are not going to do it alone, but you need to have very smart people from your team. Actually, you take to work with them so that they won't drown you, because they have more skills, they have more money, they have more connections, and obviously, you definitely have to look at that. But the good thing is that it is you, it's your country. And that played out a number of times. For example, a couple of times I told them that the data they are showing us, I will not buy it. Because if you are coming to Nigeria and see you are gathering data in Nigeria, we as a country must validate it. You can't bring it out and say, look, I said, no, this is not our data. We must go back home and look at this data. So those are things that I think become extremely important. But the most important of all is that watch the agenda of the partners. Does it align with your own agenda? And if it doesn't, you come out clearly and say, look, this is what we want as a nation. And if you don't do that, then programs are going to happen.
I want to find out from your experiences, when you want to select a leadership team, like a management team,
yes.
What do you look out for in the people you select to join your management team?
Okay, I already told you something that I look at across board my staff. And in work with staff, obviously you should be looking at them. I want to look at intellect. I want to look at energy. I want to look at integrity. Very key things that loyalty is important, but I noticed that if you explain to people and you have a good working relationship with people, loyalty becomes a very important thing. So it's critical that you must look at those, and then I also look at, very importantly, people who buy into the vision, your vision. Where do we want to go and how do we want to go there and all, blah, blah, blah. So that is a very critical, and I also give examples because, let me give an example from much earlier. I was one of the first people to start, working on doing research on HIV. I had just come back from a Commonwealth Research Fellowship at the London School of Hygiene on immunology and infectious disease. And that time, HIV was coming up. It hadn't even reached here. So, and they asked me there, why is Nigeria not? I said, no, Nigeria is going to be part of it. When I came home here, I now decided that, look, let me put an eye to HIV. And I guess that apart from the people in Lagos who saw the first cases, the subsequent ones, I was one of those who saw them in Jos. So I now looked and I said, this is going to be a massive thing for Nigeria, given our population. And given that we are really not ready to tackle any epidemic. So, I now call for a research team. I guess, I'm not sure of the real number, but like 35, 40. Of course, everybody thought maybe this guy has money, so he called us. So I told them that I don't have money, but I'm looking into the future and I see that this is going to be a big problem. And that we can actually be like the leaders. And it really played out because, so I now decided to start a clinic in my office. I'm talking about 1996-7. I started a clinic in my office. So I called subsequent meetings. 35 reduced to 15. Then 2001, Gates Foundation gave Nigeria $25 million. We were supposed to be part of it. So you can see, somehow, the selection had, and I was the leader in the, so I already speak the name, because you could see, these are people who bought into the vision, they had commitment. And if you go to Jos now, those are the ones still heading the place. There are a lot of great work there, So it's important, that you look at people who buy your vision, and it has helped many of them, because some of them have emigrated from the good work they are doing and all that. So for me, those are the critical things.
Earlier on, you mentioned the percentage of your team members who will just be, the ones who drive results.
Yes.
Another percentage are just, come in, come out, earn a salary. Another percentage that might pull it down. So I know that in your experience, you probably come across those who you said, you know what, you're not a good fit. This is just, we can't do this again. How have you approached situations where people are just not a good fit or not just performing well and you have to do something about it?
So there are many ways of approaching it. When one is not a good fit in one area, the question is, can he be a good fit in another area? Obviously, you need to discuss with the person. You need to discuss with the person, and usually you need to discuss with members of the team. And I have had situations where people were placed in M&E, it became a bit difficult. They will come to you and say, look, it's difficult for me here. It's challenging, but I can work in this area. So, that's usually by the time you are taking somebody, unless you didn't go through the right channel. If you're looking at least on merit, everybody can play something. And some, it may be because you need to enhance their capacity. I worked in public service. I took somebody, he's a graduate, and he came from one of these high-profile people. So he walked to me and said, look, the place they put me, I like it, but my knowledge is poor. So I had to now build a small team, to reinforce this. And he eventually, exactly. So you will find that people will find a place that is comfortable for them. And if you work in an organization like the one I did, really an array of areas where people can work, So that's how I manage. I'm not sure whether there was anyone that I now said, look, you must go. Something also happened. I was very academic, and I used to do it in the various organizations I worked. I recognized that some of the drivers were very smart, but they just became drivers because of their circumstances. So I now encourage them. I said, look, you're a young person. You can't be a driver all your life. You've got the potential to be what I am. It's just that you didn't have the opportunity that I had. I encourage you to go and enlist in the university. We will write to us, we will allow you. And a couple of them have moved from drivers now to, senior staff. One of them is doing an MPH. My driver who I encourage, he did a BSc in social sciences and he's doing an MPH now. And taking it from there, even the people who look after my gate, same thing. Because the whole world is about encouraging people. And I encourage a couple of them. There's one that we encouraged around 2030. He said, from Enugu State, he doesn't have money. I said, no, you don't need money. Look at this open university. We can support you. After about 4 or 5 years, he came back with a 2-1 in political science. So, this is what makes life. So if you can do it in that setting, you can do it. Because your home is your organization too. So I think that if you look very well, and it changed a lot of people. a lot, even some of the people who didn't like me when I came, not because they had known me, but they were used to the former person and they were having some benefits from suddenly. So if you look at that and you're able to start seeing, because everybody wants to be enhanced in life. And once you motivate them, by giving them training, by giving them scholarship, I started Fogarty, because I was chair of Fogarty in IHBN. I sent one or two persons to go and do masters, and I even sent one person to do a PhD, and then I had good relationship with AP. So many of them. So all these things really help motivation. Everybody can be motivated.
Everyone can be motivated. That's
Yeah.
a good category.
Yeah.
So recognizing that all leaders, report to someone, either to a board or to someone. Can you please speak about your experiences with managing corp?
Yeah, okay. I have been in those positions severally. I think that the first thing is you've got to understand your boss. What is his personality? Where does he want the organization to go? What is your own contribution to ensuring that he does that? And of course, loyalty. And being honest and frank with the person. For example, I was Deputy Vice Chancellor of University of Georgia for 4 years. And my boss was my very good friend. In fact, when he wanted a Deputy Vice Chancellor, he asked me. I gave him 5 names. I didn't give him my name. I told him I was not interested. So he called me later and said, I want you and you only. So, we're close. And I told him, in fact, I was brutal to him in terms of frankness. We had a big crisis. I was going to mess him up, and I said, look, you are the boss. You take responsibility. If you don't do this, the university will go into crisis. Trust me, if you do this, everybody will respect you. He did it. We went to court because of this thing. But he won. He won. And then and sometimes, if you don't, we had a crisis again. And I tell you, it's not, how universities run. He trusted me so much that I was the chairman of all the capital projects. We were building a library over 400 million. I was the chair. And the contractors are very smart. So when they finished it, there's a point when you have finished with the contractor. Signed everything, blah, 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 blah. So they always come with a story. We have some big men to go and bank in Abuja and all that. So my boss called me. So what's your advice? So forget about it. By the rules, they have signed off. As far as this contract is concerned, dusted, done. But you know what this money sometimes is? Not his fault. Fortunately, at this point I was leaving after 4 years, but he still was on. There was a new DVC, a new council, and everybody was hungry. So they just went out. And the man gave them money. Then the next time there was a big university visitation. That was the first thing they went to. That's how he lost his job. So I'm just trying to say, it's very important to be frank to your boss, because he will respect you. And he did. He really respected me. So that's how I am loyal. I will tell you the blunt truth, and I will help. I'm very creative, so I give you ideas of how we can move the organization and all. When I came to NACA, they had nothing like research. I brought research. I got this idea of, going to states, because I felt everything, And then we empowered all the SACAs. When I came in, there were only less than 10 SACAs. And I said, HIV is transmitted at the level of communities. You can't stay in Abuja and in California. So you have to go down to that level.
So we just heard from Prof about loyalty, but even with loyalty, speaking truth to power, developing executive courage, So, Prof, with leadership, there's so much to do. You're so busy. How do you decide what to say yes to and what to say no to? How do you make that decision or request for your time?
Well, I think the first thing is that if you want to run your life well, you must set goals, just like you set in programs. And you have to reduce those goals from yearly, monthly to daily. That decides really how much time you can give to yourself and to others. And when you set your goals, you set priorities. Which one must I do today? If I find out that what I must do today occupies my whole day, I will be honest with you. Say, look, I have got jobs. If I don't do it, but I have looked at this day, maybe I can find time for it. I think for me, if you use that principle, you'll be fair to yourself. You must pay yourself first.
And alongside that question is, how do you find time? What do you do to renew yourself, to keep thriving, What do you do?
It's very, very interesting. Well, for now, I can tell of now, because, when you are retired now, you have a lot of time and you don't have a lot of time. And I tell you the reason. If you will not believe it, it's when you retire, you need more money. I'm just being honest with you. People think you need less money. So you need to work, but you also need to slow down. So what I do really, basically, is I put myself to work. It's challenging, but it's very good. Because if you don't work, everything slows down, from your brain to your heart, to your lungs, to your body system. If you see people dying shortly after retirement, it's because they slow down their system. So I still run myself in an office mode. The only thing now is that I don't have to be there at 8 o'clock. So I start my day early. I actually do my mails and all those things before it. And I have more time now. I will listen to things that make me laugh, political platform, this, that. I do all that. Then I take my breakfast. I go and have my wash. Then I settle around 10. And I'll be in my office till 7. That's a daily routine. And maybe I have lunch, like 1 hour or something. And usually I have a lot to do. Fortunately, like a friend of mine said, I'm retired, but I have second-hand value. But I spend my time. I do a lot of, I listen to a lot of music. I watch games a lot, especially football. And a lot of my time, because I look at football as a game, but also as a science and an art. So, and then, that I have a farm. So it's a whole lot of things when I go there. I learn many things. I learn from the land. I learn from the crops, the plants. I learn from even the people who work for me there. So it keeps me, I'm very sort of engaged. And when I want to, the only thing I don't do well, and my children keep asking me, say, hey, why don't you take one month to go and stay in Mexico or this? They are even ready to pay for it. But I told them that I have grown up not to understand what 1 month's holiday is. I'll do my holiday in the evening, every Saturday, Sunday. But I think it's not the best. Let me just say that.
Thank you for sharing. What I really found really interesting is how you derive energy and even inspiration from everything around you, including books and people.
I learn from all of them. If you see my, I learn.
You be intentional about doing that, right? For you to be.
No, it just comes up. But I have been doing like a Greek. My wife tells me, what is it? So everything's not money. When I tell her that I learn so much, You know, if you want to enjoy nature, I grow a lot of corn. When I say corn, sometimes I have 100 hectares of corn. So I just come and stand around July, August. Look, there's so much to learn from nature. You just see your field, it's all green, you know? And then you interact with the workers, and you learn so much. And you help them to learn. I bought a combine harvester from India. If you go around the country, most people combine harvesters are gone. But you won't believe it. These are, my manager is so smart. He took local boys, taught them how to drive tractor, but made them mechanics. At least basic things. So these boys from the village, they can remove everything in that combine. The first time I went to to service it, I took one white guy from here. He charged me 500,000, the company. But I now, so the boys now, I said, look, what is it this plan is doing? We cannot do. So gradually, I bought the book. They will remove the things. Now, they service everything. You can imagine those type of people. Yeah, cost saving, but what they have learned. You know, so, and what they have taught me, you know, that it teaches you that, look, if you really want to do something, you can really do it. So, I enjoy a lot of this, even no money. Unfortunately, that's what the country is about. But if we can change to be more creative, it will be a much better country. And leadership should be about being creative. I think we need to emphasize that. That's the intellect in it. This country is really going into pieces. And I tell you, especially from education, we're lacking creativity. That's why the country is, you know, if you go and see all these schools now, everybody's looking for paper qualification. The work that these guys are doing, for example, is creativity. Many of the people who have degrees, can they do the work they are doing? The answer is no. And then to worsen it, because paper is so important, paper qualification, there are all sorts of, miracle centers. And you know what that does? It kills the brain. So you have a country where parents are ready to pay money for their children to buy, success. So how does the child? And then these people are going to become the big guys, and some of them already are, either in public service, in the industry. So, yeah.
With COVID, we can't have any conversation without touching on that.
That's
the
true.
Pandemic taught you about leadership?
Well, many things. Many things. Let me start from the area that I'm really, comfortable with. Health. You have seen how the world faced a new epidemic. And the question that I asked, did we face it that way? It goes back to what I was saying. It killed a lot of people in the year. We're just lucky. Nobody even understands. It's a big research area. Why did it not make more people sick and kill more people in Africa than? So we lacked leadership in terms of research. And I can tell you, I'm on one or two committees that have been looking at people's researches, looking for local health. And what they write is rubbish. You can see that people are not. So, in terms of, and then we have not learned lessons from the first one. I did so much for HIV. It's an epidemic like HIV. The only difference is that instead of being a chronic epidemic, it's an acute epidemic. There was no area that HIV has not taught us about. Whether it is political commitment, whether it is how to ensure that we build our capacity, both material and human, to face an epidemic, whether it's about managing chronic illness in the face of epidemic. Because a lot of people died. The risk factors were, diabetes, hypertension, lung disease, blah, blah, blah. These are things, but even more importantly, leadership at the level of community. Just like I mentioned about HIV, it's transmitted at the level of community. The 4 T's that we should have done at the level of community, we didn't do. A, we didn't test enough. B, we didn't treat enough. C, we lacked trust at the level of, can't remember the 40 now, but everything, we fail to understand that this is a community-based disease. And therefore, we need, so there was poor leadership there. And of course, I don't want to talk about political commitment, and, we're just lucky that. So that's one big thing. The other big thing is that, we need to come together. It is a time for the world to come together. And that's how we need to copy what the West did. They saw an opportunity to develop vaccines. We don't have to develop, but if we had come together, even in our country here, between health and many of the other, because this thing was like HIV, affected health, affected infrastructure, it affected foreign relationship, travels. So we didn't do it well, and all we're doing from our individual to our organizations to the national, it was very disjointed. Coordination, another thing that was lacking, which also we learned from HIV. So, so there are so many things that I believe that we did learn. And then, very importantly, we have not learned how to be proactive, how to prepare us. There's going to be another epidemic. We know that. I'm an infectious disease physician. Every 5 to 10 years, a new infective agent is going to come that the world is not used to. And we're not prepared for it. So, there are so many things. And obviously, we need to have some money for emergencies. And the economy, the money is the most important thing. And we need to build our institutions. I just heard yesterday that Moderna is going to establish a vaccine plant for Kenya. It's so that they can prepare for the next one. So, they are doing very little in terms of vaccine research. 2, we had a vaccine lab nearby. We sold it. And so you can see at the national level, and even at institutional, the ministry, and all this. So there was failure at all those levels. And I think we need to build capacity. Capacity to be able to address the problem that confronts us. I don't want to mention that because after the district, there's no reason why at the level of our development, anybody should be going abroad for treatment. I'm just being honest. So, if we cannot look inwards, and then ensure that we also need to be able to look at oxygen. There was not enough oxygen. PCR. We started doing PCR in 2000. They didn't have enough PCR since around the country. Up to now, they don't have. So these are some of the things for a big country like this. And the big lesson is that we cannot be spending 4% on health. Let us attain that minimum of 15%, which, the Abuja Declaration.
Wow, it's been quite a conversation. You will agree with me that if we have Prof here for longer, we'll certainly get more, but we can only do so much. So, Prof, thank you so much for sharing what you shared. Yeah. And everything you've shared is important. But if you were to leave 3 things with the emerging generation of public health leaders, what would those 3 things be? I know you've shared so much.
I will go back to my initials. Intellect, creativity. There's one thing. Because that's when you keep finding out the truth. Finding out new things. Energy. That means keep working at it. Yeah. Everything is doable. It's just that we've got to persevere. Yes. And then, of course, integrity. Integrity to yourself. Integrity to your organization. So you are accountable to your mission, to your vision, to your goals. And, to your partners and the nation. For me, those three things. And it's not my word. I told you, I'm quoting Warren Buffett. And you all know Warren Buffett. He's also a friend of Gates. And he's supported. So if you take those three things and look at them, that's what we need.
Wow. There you have it. A conversation with Professor John Idoko. I can tell you need to save this and watch it over and over again because you can't even process it in one way. Thank you so much, Prof.
My pleasure.
Us to inspire.
My pleasure. My pleasure.
Please stay tuned, stay inspired, and look out for the next conversation with the next